Diabetes and swollen feet, how to lower your risk. Hello to all my subscribers and anyone new to this channel. Ever wondered what can cause swollen feet and diabetes? In this video, I'm going to show you some of the top habits that can help lower your risk for diabetes and swollen feet. Diabetes is a condition in which the body either does not produce enough insulin or cannot use insulin properly. In people with diabetes, sugar builds up in the blood instead of being used as energy. If you have diabetes, you may be familiar with the problem of swollen feet. This condition can be quite uncomfortable and even painful. Swollen feet can make it hard to walk or put on shoes. In this video post, we will discuss the causes of swollen feet in people with diabetes, as well as some treatment options that will help to manage the condition more effectively. Diabetes and swollen feet. Diabetes can cause many different foot problems. One of the most common is peripheral edema, or swelling in the foot and ankle. This can happen when diabetes damages the small blood vessels that bring oxygen and nutrients to your feet. When these vessels are damaged, fluid can leak into your tissues and cause swelling. It's important to check your feet daily for signs of swelling. If you notice any swelling, redness, or pain in your feet, contact your doctor immediately to avoid serious complications, like ulcers, infections, and even amputation. The correlation between diabetes and the swelling of the foot. There are a few things that can cause this. The most common cause is when there is too much glucose in the blood, which can lead to diabetic neuropathy. This happens when the nerves are damaged from high blood sugar levels. Diabetic neuropathy can cause tingling, numbness, and pain in the feet. And it can make you feel as if you're walking on pins and needles. Other causes of swollen feet includes kidney disease, heart failure, obesity, pregnancy, standing, or sitting for long periods. Treatments. If it is due to diabetic neuropathy, treatment focuses on managing blood sugar levels. This may include diet, exercise, and medication. If you have swollen feet, it is important to see a doctor to find out the underlying cause. You can do a few things to alleviate the swelling in your feet if you have diabetes. Some simple tips. Elevating your feet can help reduce swelling. The gravity helps drain fluid from your feet and lower legs back into your circulatory system. This reduces the fluid in your feet and ankles, relieving swelling. You can use a footrest, ottoman, or pillows to elevate your feet when sitting down. Make sure that your knees and hips are at a 90-degree angle or higher so that blood can flow more easily to your heart. If you spend most of the day on your feet, take a few minutes every hour to sit down and prop up your feet. And when you lie down at night, put a pillow under your feet to keep them elevated above the level of your heart. Doing this will help reduce morning swelling. Reducing your salt intake. Salt makes your body hold on to water. This can lead to swelling in your feet, ankles, and legs. Too much salt can also raise your blood pressure. This puts you at risk for heart disease and stroke. If you have diabetes, you should limit the amount of salt you eat daily to no more than 2,000 milligrams, or at least 1 tablespoon. You can find the amount of sodium in foods by looking at the nutrition label. Foods high in sodium includes processed foods like deli meats, frozen dinners, canned soups and vegetables, salted nuts, soy sauce, barbecue sauce, ketchup, bacon, pizza, sausage, hot dogs, and pickles. You can also ask your doctor or dietitian how much sodium is right for you. Salt substitutes are not a good idea because they often have potassium in them. Too much potassium can be dangerous if you have kidney problems. Exercise regularly. Exercise is important for everyone, but is especially important if you have diabetes. That's because exercise can help control your blood sugar levels. It can also help your body use insulin more effectively and lower your risk of heart disease and other diabetic-related complications such as kidney disease and nerve damage. Before starting an exercise program, talk to your doctor about what types and how much exercise is safe for you. If you have any of these diabetic-related complications, you may need to take special precautions when exercising. For example, your doctor may recommend a different type of exercise or a different level of intensity. This is just a general overview of how exercise can help if you have diabetes. For more specific information, talk to your doctor or another healthcare professional. They can create an exercise plan that's tailored to your needs and abilities. Wear supportive socks or stockings. One of the best ways to prevent or relieve foot pain is to wear shoes that fit well and support your feet. If you have diabetes, be sure to wear shoes and socks at all times, even when you're at home. You may need to buy custom-fitted shoes or special inserts for your shoes. Your doctor can help you find a shoe store that specializes in fitting people with diabetes. Avoid high heels and sandals without straps. Look for shoes with a low heel and good arch support. Wearing socks and stockings with your shoes to protect your skin and help prevent blisters. Limiting your alcohol intake. Alcohol can cause the blood vessels to become even narrow, and this can increase the risk of developing foot problems. If you smoke, quitting smoking is one of the best things you can do for your health. Smoking cigarettes constrict blood vessels and decrease circulation. This can make it harder for wounds to heal and increase your risk of infection. If you have diabetes, quitting smoking is especially important because it can help improve your blood sugar control and reduce your risk of complications. Conclusions. If you're experiencing diabetic-related swelling in your feet, it is important to seek medical attention. Also, if you find the video to be informative, please give us a thumbs up and click the subscribe button so you can be notified weekly of more informative videos. Please share your stories in the comments.